Hey guys, this is Dr. Pat at the Springfield Wellness Center, and today we're going to be talking a little bit about the temporomandibular joint, commonly known as the TMJ. It's a joint that's located on either side of the face. We'll just use Kat's right side here, for example. It's between the mandible bone, which is under here, this part of the jaw, and it also involves the temporal bone here, which is on the side of the skull. It can be found here just in front of the ear. This tissuey part of the ear is called the tragus. Just in front of there is where the joint resides. And part of our assessment when we're looking at TMJ and if it's dysfunctional or not is actually placing our fingers at this area and having the patient go ahead and open their mouth. So Kat, if you want to go ahead and open your mouth, we're going to feel, to assess the motion of the TMJ here. So go ahead and close your mouth now. So it feels pretty even. Go ahead and do it again, Kat. Just want to make sure. Yeah, so I'm feeling the motion, pretty equally on both sides. For people who have dysfunction in this area, a lot of times we'll feel some discrepancies in the motion. A lot of times it'll be less motion on the affected side than the normal side. And so one of the ways we address that from a treatment perspective is we look at the muscles that are around this joint. And so we have the masseter muscle here on the side of the face. We have the temporalis muscle up here on top. And there's also some other ones that we have access to through the mouth, but we're not going to do that for this video. But from a treatment perspective, we want to make sure that we work on some of the adhesions that can develop in these muscles over time, because we use our mouth for a lot of different things. We talk, we chew our food, even when we yawn, we open our mouth really wide. And so that involves the temporomandibular joint, and it so it undergoes a lot of stress over a long period of time. And so what we do for treating those muscles is we do something called active release technique. And so we want to try to release some of the tension from the muscles and get them back to normal functionality. So to do ART here on the masseter muscle, I'm going to take some tension and apply upward while Kat opens her mouth. So go ahead and open for me. And close. Go ahead and do it one more time. And good. Sometimes this can be a little bit uncomfortable, but those muscles are very sensitive, and so it's important that we do get in there and start to work some of those adhesions out. And same thing with up here at the temporalis, we're going to apply an upward pressure as Kat opens her mouth here and close. Very good. So getting those muscles back to the way we want them to can help that joint move the way that it's intended to. And one of the other things about the TMJ that causes pain is we want to make sure that we address some of the inflammation in that area. So when the TMJ is dysfunctional, there's a disc in between those two bones that I mentioned earlier, and sometimes that disc can be displaced a little bit anteriorly, so in this direction here. And so what can happen is there's no innervation to the disc itself, but the tissue behind the disc is very innervated, highly vascularized, things like that. And so when that tissue gets irritated, it becomes very painful and creates inflammation. So one of the things we use to combat that is the deep tissue laser. It kind of helps to break up that inflammation, and it helps kind of stimulate the healing process, accelerate it a little bit. So that combined with the muscle therapy usually allows us to get the TMJs back to normal functionality, and help people get on with their lives, not dealing with that kind of pain. So thank you so much for watching. Hope you guys learned a little bit about TMJ. If you like this video, go ahead and like the post on Facebook, share it with your friends, and visit us at wellnessspringfield.com if you have any further questions. Thanks.
To find out more about the Springfield Wellness Center and all the other services we offer, head over to our Facebook page or check out our YouTube channel.